Dana-Farber Cancer Institute is one of the leading institutions in looking at the myeloma translational science part. And during the EHA meeting, they were presenting their results, focusing on the high-risk features. But for the first time, they were concentrated on ultra-low-risk myeloma. So this is a big advancement in terms of our approach. In general, in myeloma, based on FISH, we know that about approximately 10 to 15% of patients are high risk. And the rest are usually considered as standard risk. And among the standard risk, the clinicians have experience with patients who have had long-term remissions unmaintained. And this constitutes about 10% of patients, but we do not really know their genetic background. So initiating the research and the progress in the genomics of myeloma has shown that DNA repair mechanisms and genomic instability are kind of imbalance with age-related changes in the genomic structure. And this group, led by Nikhil Munshi and Mehmet Samur, they were able to look in more detail and they developed a new scoring system, which is called the Genomic Scar Score. And this score identifies patients with a low score, which is the first quartile. And these patients are usually more dense among the hyperploidy patients. So it's not only the hyperploidy, but also 11-14 translocations are also visible in this cohort. And this low score of patients, if they are analyzed in their patient data set, they were able to dissect a major clinical outcome with the low score patients having a significantly much better survival, overall survival, and also PFS. And both were, for PFS, the p-value was 0.05, and for overall survival, it was even better, 0.006. And they were able to conclude that the major FISH-related features associated with this low score were both hyperploidy and gain of chromosome 9 in particular was the leading feature that was important. So we know that cereblon is expressed on chromosome 3, and it's also involved in hyperploidy. So then we are now approaching a field where we may be able to have biomarkers which are in correlation with response. And in addition to the Dana-Farber experience, Hartmut Goldschmidt, during his presentation in his German study where they were comparing the impact of adding elotuzumab to the VRD backbone, he presented their data on measuring transcription factors which are activated after the cereblon pathway, and they were able to present their previous data, and also to confirm in this data set flow cytometric measurement of these zinc finger transcription factor related proteins is able to be in correlation with outcome. And so cereblon pathway and downstream of cereblon related proteins, Icarus and Aiolos. And in addition to this, the hyperploidy and low genomic scoring, these may be promising for future as predictive tools for for better outcome, and in future we may see a change in treatment paradigm in such patients, and it's becoming a new era where not only focusing on high risk, but also ultra low risk patients may be another treatment algorithm change.